And so a lot of persons may be insured or uninsured or self-paying for their healthcare, but not realizing that even with, a great healthcare plan, when it comes to fertility, either evaluation, treatment, even to establish the diagnosis, they may not be covered under their health insurance plan.
Whoever thought making a baby could be so hard? Luckily, the fertility journey isn't meant to be traveled alone. Eloise Drain has helped hundreds of people build and grow their families over the last 15 years, and she's ready to share her insider knowledge and expertise with you. So grab a seat and let's talk fertility and alternative family building in the Fertility Café.
Hello, and thank you for joining me on Fertility Café. I'm your host, Eloise Drain. Today, I have the pleasure of speaking with Dr. Tia Jackson-Bey to discuss disparities in fertility care in minority populations. There are particular barriers to caring for and noticeably poorer treatment outcomes for Black and Brown women. We're highlighting health disparities that prevent family building through fertility diagnostics, gynecological surgery, fertility preservation, egg, sperm, and embryo freezing, and infertility treatments like intrauterine insemination, IUI, and in vitro fertilization, IVF, for minorities. We'll be discussing the importance of reproductive justice and increasing access to fertility care for all. Dr. Tia Jackson-Bey is a reproductive endocrinologist and infertility specialist and board-certified obstetrician-gynecologist who cares for patients at RMA of New York's Brooklyn office. Her professional interests include physician-patient education, IVF outcome improvement, global public health, and mentoring unrepresented college and medical students on careers in medicine. Dr. Jackson-Bey is passionate about reproductive justice and increasing access to fertility care for all. She was recently appointed a member of the newly formed ASRM Diversity, Equity, and Inclusion Task Force, which will enhance opportunities in reproductive medicine for underrepresented minority populations and reduce health disparities in access to care. She is a talented surgeon and dedicated fertility expert who is focused on fertility preservation, IVF success, and great outcomes for her patients. Welcome, Tia. Thank you for joining me. Although I shared a bit about your bio, I'd like to start off by having my guests share a bit about themselves. So if you don't mind, share a bit about you.
Awesome. Well, thank you so much for having me. My name is Dr. Tia Jackson-Bey. I'm a reproductive endocrinologist and infertility specialist based in New York. And so as part of my job, I'm trained to take care of women as a gynecologist and obstetrician, but then went on to do further subspecialization, particularly in disorders that relate to fertility. So the majority of the patients that we see are coming to us because they are not experiencing pregnancy in the time frame that they ought to. So they could be infertile or just have questions about their fertility or have, chronic conditions that may, affect their fertility, things like uterine fibroids or endometriosis, or been told by a doctor before that this is something they need to kind of be cognizant of. So we may see them for those reasons as well.
Okay. So I know obviously the topic of this conversation for today is about healthcare disparities. Tell us about the barriers to fertility treatment in underserved, low-income, minority, LGBTQ communities. Like, what stands out to you as being the most important that we need to focus on to make change accessible?
Yeah, one of the biggest, I think, initial barriers is cost. But to take one step before that, I think it actually is knowledge. We encounter a lot of persons who don't realize that there's an issue for not achieving a pregnancy in 1, 2, 3, 5, 10 years. They may kind of have a suspicion, or maybe they blame it on other things. Maybe they don't know the right persons to seek. They may have also been told by their doctors in error that they should just keep trying. And so that can be a huge deterrent in terms of them making it to our door in terms of fertility specialists. So just knowledge of the body, knowledge of, the menstrual cycle for, menstruating persons, understanding what it takes to achieve a pregnancy. And therefore, sometimes that can help you to know how to optimize your natural fertility, or when things are going wrong and you may need to seek assistance. It could be a big part of it. in terms of cost being a barrier, infertility is one of the very few diagnoses that is not universally covered by health insurance. And so a lot of persons may be insured or uninsured or self-paying for their health care, but not realizing that even with, a great healthcare plan, when it comes to fertility, either evaluation, treatment, even to establish the diagnosis, they may not be covered under their health insurance plan. And so in some ways that's, it's very cruel in that they have this medical condition, their organs are not functioning the way that they should. And, for whatever reason, they can't seek the treatments or even sometimes the evaluation to deal with that diagnosis.
Mm-hmm. And, going back to a point that you made about education, I think one of the things that we as a society need to do better at is even educating our children from young, because that is quite frankly where it needs to begin. It's not, by the time you get into your 30s and your 40s, and now you're thinking about having children, it really is about having these discussions once you become a teenager. And, as a woman, you start getting your period and not just women. This can't just be a woman thing, right? This needs to be an every person thing, man, woman, whatever.
Absolutely. Absolutely.
But I mean, how do we even get there? Like, how do we, and I know obviously you're not going to have the answer to all these questions, but I think that having an opportunity to begin having these dialogues with individuals, even with your own journey in your own education and deciding that you wanted to become an RE, how do we try to help educate our young children so that they are aware of like, what things do we need to even consider? Like, what should I be telling my daughter or my son as their teenage years?
This is, something that we've been discussing so much in recent years in terms of why is this part of, sexual education left out? I think the focus of a lot of kind of school or curricular-based sexual education is all on pregnancy prevention. Mm-hmm. And in some places still very abstinence heavy without, just a full appreciation of, one day you're going to want to have a family and this is how you do it. This is, the right time for intercourse in order to conceive. This is the right length of trying before seeking new treatment or seeking an evaluation, or these are the kinds of things that could go wrong. Part that's left out is about, sexually transmitted infections, as a young person can predispose you to infertility later on, particularly gonorrhea and chlamydia. And so, it can be wound into the current curricula. I think there's just not enough of a focus on it as is. There are some great activists in the infertility space who also advocate for, telling the younger persons in their family mm-hmm. about their own infertility struggle so that it doesn't come up as such a surprise, 20, 30 years from now. And I think that that's incredibly remarkable too, because, there's something to be said for secrets and privacy, even within a family, mm-hmm. to the point that other members of the family don't know what you're going through, siblings not knowing, are they struggling? I don't know. I don't ask. Women or persons not knowing what their parents had to go to in order to achieve pregnancy. Was there a history there that we should know about? And so those, just I think in open discussions with mm-hmm. their family members is really important. My mom was very open with me about like her reproductive history from early on. And maybe I just kind of tuned into it because I always had like an interest in the health field. But I think even something like that is helpful just to let you know what the possibilities are and that it may not go as smooth as you imagine. And so these are some things to kind of, ask of your physician, your healthcare team, or just to be aware of for yourself. So I think definitely speaking to persons who are close to you, if you're involved in any kind of community service or mentoring, have, sexual health day, the same, way that we want to teach particularly young menstruating persons about their menses and what does it mean, take it the next step further and let them know that this is, what this means in the grand scheme of things. And one day you may want children, and this is one way to pursue that. another thing that's important is for young queer persons and trans persons that someone is also talking to them about family building options for them as young people, because they may need assistance or they may even need fertility preservation if they're considering transitioning. And just to make sure that they're aware of all of the options, things you want as a young person can be very different from what you want in your 30s or 40s. And so someone should be planting the seed just to let them know what's available.
Well, that, and I also think that we need to begin also having discussions and letting people know that they need to become their own advocates. And they need to be questioning everybody, physicians and, whoever they have in their space that is giving them information or perhaps not giving them enough information, and deciding like, okay, I have to become an advocate for myself, because down the line, I'm the one who's going to have to deal with all the issues. So what do you tell somebody that, as a physician, about advocating for themselves when they're in front of their own physicians?
Yes, this is so important. And I think that it's important that persons know, one, that they have the right to health. I think sometimes in our country, you can make it seem like healthcare is a luxury, but it is a human right. And so, just to understand that, yes, it does not matter your education, your income, your, legal status in this country, your marital status, your sexual orientation, your religious affiliation, you do have the right to be evaluated by a healthcare provider and to have your questions answered and heard. Those opportunities may be different based on where you live, and that's a very real thing. But I do want persons to feel empowered in that way, is that this is something that you should expect, not feel like, is outside of your reach. In terms of, advocating for yourself, I think, there are a few different things that come to mind. Sometimes it may be helpful to bring someone to a visit with you, either for comfort or for reassurance, or so they may just hear things differently than you do. They may remember, different parts of the appointment different. Now, of course, this person may be privy to your health information. And so you have to make sure that it's someone who you're comfortable disclosing all of your health data in front of. But, is it a partner or a friend? I've had patients bring parents or adult children, just someone else. I think a buddy system sometimes can just be very reassuring in an encounter that can be somewhat intimidating. I think maybe having some questions available in advance is helpful, so that even after, the doctor kind of does their spiel, or, nurses or whatever, so that you can kind of have a reminder and maybe not be afraid to speak up and say, okay, this is why I'm coming here. This is something I don't understand. Can you repeat that? Or can you help me understand how we're going to get from A to B? What is the timeline like? What is the commitment involved? Does my partner have to be involved or not? And so these are kind of important things to just remember. And the questions can be pretty much anything you want, but whatever it is that's important to you, it may be worthwhile to write them down in advance of your visit. You can ask certain things before you arrive in terms of health insurance questions, whether or not your insurance is accepted, what happens if it's denied, what is the cost out of pocket. A lot of times they may, get in contact with that information as well. But sometimes I hate when patients have like sticker shock from arriving to a visit because they didn't know that maybe some aspect of it wasn't going to be covered. And they may get all the way there and, have traveled there, and then they want to leave because of that. And so sometimes it might be helpful to do a little bit of that research before the first visit. And then other things I think, which can be hard for different groups, and I definitely appreciate that, is just to, make your intentions known. Like if this is something that you're very committed to, if you're not feeling heard, if you're not feeling respected, in some cases, instead of just changing course and never coming back to the practice, it might be helpful to give that feedback Physicians are humans too.
Mm-hmm.
They're not perfect. I think a lot of times there can be a lot of medical jargon that's used. There can be unconscious bias, which all humans have, but which is actually very pervasive in medicine and can affect your care and your outcomes and your treatment. And so sometimes just by, addressing it in a way that's comfortable for you, just can bring it into the consciousness of the healthcare team, and maybe they can make some changes from there. It may very well be that you choose to continue your care somewhere else. That's a possibility for you. But I think, in this struggle to really become a better healthcare system, we have to have that feedback. And I would really encourage any person to make sure that you provide that if that's your experience.
Well, that, and so touch base back onto this health disparity, specifically want to touch on the Black and Brown community. And I know that over the years, I have heard numerous times about families or individuals that have gone into the doctors and they've been complaining about certain things, and the doctors are completely dismissive to what their issues are or their concerns are. One, why do you feel there's such a healthcare disparity besides cost? Why do you feel that there's such a healthcare disparity in the Black and Brown community right now? Because, we are way more educated than, our parents were and our grandparents were. But yet and still, we're still dealing with the same, maybe not the same, but we're definitely still dealing with a lot of the issues that they dealt with in their, when they were trying to have children. Why do you still think that it's still prevalent?
Yeah, it's definitely a multifaceted issue, and I don't like to really categorize so much. There are some things that, kind of stand out to me. I think one of the biggest, and we talked a lot about knowledge, is not necessarily a knowledge base, but like an understanding of what is, to be expected, what is possible, what is kind of, a normal length of time to try before seeking treatment. One of the statistics that really stands out is a lot of times Black couples present to infertility care with a longer duration of infertility at first consult. So that means that, for a couple that maybe was trying a year, the Black couple has typically been trying for twice as long. And so they may have been trying for 2 years before they seek treatment. And the reasons, can be varied. Maybe they expressed concern to physicians and were told that they should just keep trying. And so referral patterns to subspecialists has been something that's been shown to be different for different races, whether there are assumptions on the physician's behalf of affordability, or, to this day, there are certain groups, including, us, that don't realize that infertility affects Brown and Black couples. And so that's, also kind of a big issue in itself, is this idea of that's not an issue for these people. Or if it is, well, they can't afford the treatment anyway, so I'm not going to send them. So those are, some of the biggest things in terms of like referral. But then also, just an understanding of what's normal. I do have, a lot of interactions with, patients, or even just, people who we meet along the way who say, well, I was trying and I'm just really kind of leaning on the Lord. And, I call this the praying for a baby. You can continue to pray, but I definitely want you to come in and be seen. I also want you to pray for the right doctor who's going to listen to you and who's going to address your needs. And so, I think sometimes, either fear of what they'll be told when they come to the doctor, stigma, of even from their partner, from within their family, within their social network, for maybe having issues conceiving, a lack of understanding because no one else is talking about it. And so feeling like, am I the only one? Why did this happen to me? Everyone else is, having children with no issue. Or even sometimes I had my first children, child or children with no issues. I don't understand why it's so difficult now. But all of those things should be reasons why you're seeking treatment, or at least seeking an evaluation to figure out what's going on. So, there's some kind of understanding. Cost certainly plays a huge, huge role. As I mentioned, with infertility diagnoses not often being covered by health insurance, right now there's only 19 states out of the 50 US states that have some sort of legislative mandate to say that infertility treatment should be covered by health plans in that state. But even within those mandates, there are huge gaping loopholes, including, sometimes the evaluation is covered, but not the treatment. Sometimes one type of treatment is covered, but not, one of the most efficacious treatments we have available, which is in vitro fertilization. Only about 5 or 6 states specifically include in vitro fertilization as part of that insurance mandate. And so you can imagine that leaves a lot of persons without insurance coverage for infertility treatment. What that does is it creates a huge chasm in terms of who can get treatment and who can't, because the infertility treatments can be very expensive out of pocket. Something like in vitro fertilization can run tens of thousands of dollars for one try. And we know that sometimes to be successful, you may have to try more than once. Just the evaluation in of itself, it may require, out of pocket payments or multiple physician's visits, which can be, disruptive to some person's work schedule or distance traveled in order to get to the clinic. The clinics at this time tend to be located where patients can pay in cash.
Right.
So they're located in cities. They're located, on the coasts. There's not a lot of rural representation, Midwestern, huge swaths of the country and populations are not, adequately served or have to drive maybe more than 100 miles to seek care at a fertility clinic. And so these are some really significant barriers to care overall, not having that insurance coverage and then also having clinics situated in communities that are more affluent, to tend to be more white, tend to be more urban. That certainly, it plays a big role as well.
And I know we keep talking about health disparities, obviously, in the U.S. here, where clearly we're here. But you've traveled to Honduras, South Africa, Ghana, Tanzania for various projects in women's reproductive health. What did you learn in your travels about universal disparities in women's health care, specifically reproductive care?
Yeah. I mean, there's so much to learn from all different, areas. I think some things it makes you reflect on, some things that the U.S. does well, and then some things that the U.S. does not do very well. Taking care of a woman through pregnancy, early postpartum period, we're not so good at that, actually. Despite really high amount of money spent per person on healthcare, dollars, that actual social support, you see in the news recently, we're, really looking for a national kind of family medical leave and see how hotly debated that is. Whereas that's basic, care for families and for women and children. Yourself as a mom, to go back to work in less than a month because you don't have enough leave or you feel like your job, may be lost. It's incredibly heartbreaking.
Yeah. In some places you can't even
still debating this.
Yeah. In some places you can't even bring your child to the daycare because they don't even accept a child before 6 weeks old.
Yeah. I mean, that's something that, kind of really stands out to me. But, in terms of what I see in other places, it runs the gamut. I think overall, we still have to really work hard to have women's health valued at the same as everyone else, right? So this, particular concerns of women in other places may not be as highly regarded, but, there is some hope there. I think fertility concerns bring about a whole nother dynamic in the sense that fertility is often blamed on women without a real understanding that, yes, it takes two. There is equal contribution from male factors and female factors for infertility. But because women, carry pregnancies, the lack of a pregnancy is often blamed on women. And so that can have really significant social, cultural, and actually safety implications on women around the world. If they're unable to conceive or to have successful pregnancies, they can be abused, they can be shunned, they can be, in some sense kind of abandoned by families. And it's, like a divorce, but left without anything. And that, it just has tremendous health, mental health, safety, economic implications. And so, improving the understanding that, yes, this is not just a woman's issue. This is a male and female issue. And a lot of times it actually can be both is important to really kind of get the word out there worldwide.
Mm-hmm. And, reaching into your experience as a gynecologist, and especially right now with women and dealing with the high maternal fetal deaths that we're having now in the U.S. I mean, why do you think that is? And it's not all of a sudden, clearly. It's definitely going up instead of down. Why do you think that, especially, let's look at this country, right? And all of the capabilities and the possibilities that we have, like we're going the wrong direction.
Well, I think it's a few different factors in terms of why infertility rates are increasing. That's what you mean?
The maternal fetal deaths?
Oh, maternal mortality.
Sorry, yes.
So, there are still some pervasive issues. One of the most important is the role of systemic racism and what we call unconscious bias. Unconscious bias means that, you may form opinions, you may act differently, you may think differently about different groups, and it may or may not be something that you actually recognize. We've probably all been socialized and trained to think, okay, to recognize patterns. You see brown skin, this is what this means. You see, dark skin, this is what this means. But unfortunately, if, that's something that we're realizing is ingrained in medicine and is actually held by medical providers, that can mean very serious consequences. And so, that plays a big role in terms of who is recognized as actually having a medical emergency during pregnancy or in a postpartum period. If you think that they're drug seeking, which is something that you typically hear of African-American persons, if you think that they're being dramatic or histrionic, instead of really listening to their concerns, which is sometimes is explained of Latinx women, these are really important things that you have to kind of nip in the bud because it can mean life or death for some people. There have been studies that have shown that racial concordance between physicians and patients actually makes a difference. And this is something that's been very hard to get the medical community to understand. But whether it means that the patients feel more comfortable and they disclose more and they are, more in tune and therefore not shying away because they feel more comfortable with a provider that looks like them, or if it's just the provider taking an extra step to listen. Do they speak the language? Do they come from a similar community? Do they, understand some of the social constraints on health that maybe a provider who's not in that community doesn't understand? And so these are things that can, make a huge impact. And unfortunately, we aren't there at that point yet. And, they may play a role in the increased maternal mortality. There are other factors too. There are always going to be absolute health factors. As a population, we're all having children later in life. And so that kind of skews things a little bit in terms of maybe having pregnancies and starting pregnancies with, different kinds of chronic illness than we ever had before. But, I think we really have to lean into what are the structural issues that are being recognized. Are we recognizing hemorrhage early enough? Are we recognizing disorders of hypertension in pregnancy soon enough to act? And are we treating patients appropriately? And, I hope in the time since the CDC reported this increase in maternal mortality, specifically for minorities, that a lot of these changes are being made, not just at the big academic hospitals, but even smaller hospitals who have less deliveries and at even like birthing centers.
Mm-hmm. I know one of the concerns right now, too, obviously, is getting the COVID vaccine. And, there's definitely people on both sides and it's going to affect their fertility if they get the vaccine. And, even my own family members are just like, no, because if I get the vaccine, then it's going to affect my fertility and I'm not going to be able to have children anymore. And this is exactly what, the government wants because they're trying to create another Tuskegee experiment. I've recently heard that one too.
Yeah, it's really hard. I think, I definitely understand both sides. As a physician, I've seen the devastation of COVID, to even just think about the sheer number of persons that have lost their life to it, but even more persons who've been infected and have had, these long ICU stays, who are now, experiencing this long COVID syndrome with neurologic impairment, respiratory impairment that, we have no idea how this is going to look, 5-10 years from now. And so there's this urgency to, one, get the virus contained, but then two, to protect us. And, the vaccines that are available are highly effective in preventing severe illness and death. They do not take away the chance that you may get COVID, but, to prevent severe illness, that you don't have to be hospitalized, you don't have to be intubated, you don't have to, run your organs to the brink of failure, or even, unfortunately sustain death, is a significant, finding. And I think that's worth, but vaccine hesitancy is a big issue. And I think this has really kind of cracked open this Pandora's box that we won't be able to close, in that there is a lot of mistrust of the healthcare system. Mm-hmm. Unfortunately, due to, our past history in this country, due to a lot of just inaccurate information that we saw over the last 4 to 5 years with social media, and just inaccuracies on social media and how quickly it can spread. It's hard to know who to believe, and it's hard to know to trust. And so I do sympathize with that. But, one thing is that I think, we've tried as physicians to get as much good information out there as possible in terms of the benefits, the stone cold benefits of COVID vaccination. It does not affect your fertility. This has been proven in, multiple studies to date. We don't have, how it'll affect you for the rest of your life. Right. But we do have short-term data that says that it's safe, it's effective, and there are no longstanding detrimental outcomes that would, outweigh the benefits of potentially taking it now and avoiding that consequence of severe COVID infection or death. So, we're at this point now. It's a little bit of a tipping point, because we want to just do what's right. And, at this point in the game, vaccination is the way forward. So, I really encourage anyone who's still on the fence or has questions to just, try to engage, either health professionals, try to stay off of social media. Yes.
Or Dr. Google. Yes.
Right. But, just try to go to sources that you trust. The CDC actually has a very nice layout of the vaccinations, of the studies that are available, kind of very plain data on what what the COVID pandemic has looked like so far. And that's something that's available to the public. Asking your physicians, ask your pharmacists, because the pharmacists are giving the vaccinations now as well. And maybe starting there.
Mm-hmm. What about for women who are already pregnant and are considering getting vaccinated?
Yes, the recommendation now is to continue vaccination in pregnancy. So if you are completely unvaccinated, we would highly recommend COVID vaccination in pregnancy. We know that it is safe. It does not have detrimental impacts on the pregnancy. You can have, the same side effects as someone who's not pregnant. Sore arm, you can have headaches, a day or so of, fevers or something like that. But they're very self-limited, and overall it's been very well tolerated. The vaccine has been. For pregnant women, the recommendation is to go ahead and get it. It's also for, if it's your first shot or second shot or single dose, but now also for the boosters. Mm-hmm. The American College of Obstetricians and Gynecologists, as well as multiple different organizations, including the CDC, Center for Disease Control, are recommending that pregnant women get boosted as quickly as possible. What we found is that, COVID can be particularly devastating in pregnant women. And I think it even hit worse during this Delta wave particularly of unvaccinated pregnant persons. So, COVID vaccination during pregnancy increases the risk of hospitalization, increases the risk of intubation, increases the risk of needing to deliver. Therefore, sometimes there can be preterm delivery because the delivery may be needed to help with the resuscitation of the mother. And then also it does increase the risk of COVID-related death during pregnancy. And so by being vaccinated, you're not just saving yourself, but potentially saving your unborn child from infection or any negative sequelae. So it's important. We understand that, people are nervous, but all the data that has come back so far is good. And so I want you to hear clearly that it is highly recommended to get the COVID vaccination or your booster during pregnancy.
Well, any last words of wisdom you'd like to share?
The most important thing to me is if someone has questions about their fertility status, about, trying to create a family, about starting a family even on their own, that they seek, look for the doctors, look for the providers that can help you to reach your goals. Sometimes I have patients who said, it took me a long time to make this appointment. And I'm always like, I'm just glad you're here.
Mm-hmm.
Now we can figure things out and hopefully move forward. And so that's really important overall. So my, request is always that you just don't delay. In the infertility world, time is actually very important. And so the sooner that we can see you and get an evaluation, potentially start treatment, if treatment is needed, then the sooner we can get you on the road to building your family.
Yep. Awesome. Well, thank you so much. And it has been a pleasure speaking with you. And I'm certain that our listeners will have learned a great deal, and we'll definitely be sure to add your information into our show notes. So thank you for your time. I really appreciate it.
No problem. Thank you.
Awesome. I hope you found this discussion helpful as you weigh your next steps. We would love for you to rate us. So if you haven't yet, go to your listening platform of choice and subscribe, rate, and review this podcast. You can follow Fertility Café on its Instagram and Facebook channel at Family Inceptions. We'd also love you to share Fertility Café with friends and family members who would benefit from the information shared. Join us next week for another conversation on modern family building. Thank you so much for joining me today. Remember, love has no limits. Neither should parenthood.
Thank you for joining us in the Fertility Café. Whether you're an intended parent, a woman considering egg donation, thinking of becoming a surrogate yourself, or a friend or family member of someone dealing with infertility, we're here to help. Visit our website, thefertilitycafe.com, for resources on fertility, alternative family building, and making this journey your own.